If you want healthy knees and ankles, then don't overlook the ability to internally rotate your tibia. In this video, we're going to discuss everything you need to know about tibial internal rotation. Why is it important? 2 tests, 1 open chain and closed chain to see if you're truly limited in internal rotation, and why many practitioners struggle to improve tibial internal rotation. Then I'm going to show you 5 of my favorite exercises to actually make long-term progress. Let's get into it. So what is tibial internal rotation? The tibia is the shin bone here, which establishes a connection between your femur or your thigh bone and the foot. Now, your knee joint is not just a hinge joint, meaning it doesn't just extend and flex, but it actually rotates as well, both internally and externally. Now, functionally, most people are limited in the ability to rotate their shin bone inwards. Since the shin does connect to the femur and the foot, we're mostly going to see compensatory patterns at those segments. For instance, turning your feet out when you walk, run, jump, land, and squat. This is known as the duck foot posture, which can be due to many different factors, but lacking tibial internal rotation is one of those main reasons. So let's go over the biomechanics behind tibial internal rotation. In general, the shin rotates inwards relative to the femur when we bend the knee. But there's a difference between the open kinetic chain, when the shin is moving in free space, and the closed kinetic chain, where the shin is fixed and it's the femur moving on the fixed tibia, which we'll see in a squat or a lunge. In open kinetic chain movement, the tibia is generally going to follow the femur, meaning if I internally rotate the femur, the tibia is going to internally rotate along with that, especially when the knee is straight. If the entire thigh is facing inward, then the knee is going to face inward, as well as the shin and the foot. Now, in the closed kinetic chain, when the foot is on the ground and the femur is moving relative to the shin, then the tibia is going to get left behind slightly, meaning if I rotate the leg inward, then the knee is also going to come along for the ride into tibial internal rotation, but it's still going to be externally rotated relative to the femur. So the tibia does follow the femur's movement, but it just gets left behind. It's more of a timing thing. So therefore, in closed kinetic chain, internal rotation of the femur leaves the tibia in relative external rotation, whereas external rotation of the femur leaves the tibia in relative internal rotation. Now, we can speak about tibial internal rotation relative to the femur, which we just spoke about, or distally at the foot. So when I pronate the foot, when I let the arch collapse and the calcaneus everts, you can see how this kind of drags the tibia inward. Okay, now this motion is being driven through the foot. That doesn't mean the tibia is actually producing internal rotation. It's just appearing internally rotated. That's why people with very collapsed arches, overly pronated feet, you would think they have a ton of tibial internal rotation, but a lot of times that foot shape is due to people lacking tibial internal rotation, and the foot has to compensate with more motion because it's not coming from the shin. Now, we'll also see the opposite, where a supinated foot position, I create a higher arch. You could see how the shin then moves laterally. And again, this couples with external rotation at the femur as well. The pronation kind of couples with internal rotation at the femur. Now, these aren't hard rules. You can have a supinated foot and also have an internally rotated femur. This is just coupled motions that we see in functional movement. They aren't hard rules. That's important to consider. One of the main reasons I see people fail at improving their tibial internal rotation long term is just there's simply not a lot of leverage to stretch into tibial internal rotation on your own. So you're going to have better success improving relative motion at the tibia, meaning motion relative to the femur and the foot. So a lot of people try to go directly at the tibia and they just try to crank the range of motion. Maybe they grab the leg and they rotate it as they move into dorsiflexion and knee flexion. This is a great passive mobilization, but it's not going to create a lot of long-term change. What you need to do is first make sure you can dissociate motion at the femur and the foot in regards to the tibia. So like I mentioned biomechanically, As the femur internally rotates, it drags the tibia along with it. So if I externally rotate the femur, this relatively places the tibia into internal rotation, especially if the foot is facing forward. And when it comes to the foot, if the foot is planted, if I externally rotate the femur and keep the knee facing forward, then I shouldn't be able to lose that inner foot contact. Okay? If I lose that inner foot contact, that means that this forefoot can't invert, which is a component motion of foot pronation. We need a calcaneal eversion and a forefoot inversion. And usually people who are unable to maintain this forefoot inversion struggle to internally rotate the tibia. So in that case, we're going to need to work directly on the foot, especially these lateral calf muscles here, which get really stiff and prevent that forefoot inversion from happening. And working on the foot, which connects to the shin, will improve how the shin rotates. Now, improving relative motion doesn't directly address the muscles that actually produce force into internal rotation at the tibia. And these muscles are the medial hamstrings, particularly the semitendinosus and the semimembranosus. The contraction of these muscles is what actually causes knee flexion and tibial internal rotation. And this is a really important concept. You need to be able to feel these tendons pop into your hand when you're doing any sort of open kinetic chain tibial internal rotation work. Because if you're not feeling those tendons, then you know that internal rotation is coming from somewhere else. Maybe you're just rotating at the femur, maybe you're just inverting the foot to fake that motion. So before you do any exercises to improve the motion, I want you to first establish a motor map in your mind in how to actually fire the muscles that do tibial internal rotation. So grab your hands, put them underneath the thigh. So this left side, I'm grabbing my lateral hamstring tendons. This inside hand, I'm grabbing my medial hamstring tendons. So the lateral hamstring, the biceps femoris, actually helps with tibial external rotation. So as I move my foot outwards, I feel that lateral hamstring tendon pop out into my fingers. As I move my foot inwards, I feel these medial hamstring tendons pop into my fingers. Okay? And we should be looking at this tibial plateau, this bony prominence on the shin here. We should see that moving inward relative to the kneecap. Okay, so internally and externally rotating the tibia, feeling those hamstring tendons pop into your hands. And if you're not feeling that, then it also helps to flex the knee as you're doing this as well. So move the heel back, and that knee flexion along with the rotational aspect will get you feeling those tendons popping into your fingers. Okay, let's test to see if you're truly limited in tibial internal rotation. So we're going to do two tests. The first is going to be an open kinetic chain tibial internal rotation, where the tibia is moving on the femur, and the second will be closed kinetic chain. So when it comes to open kinetic chain tibial internal rotation, we want to see anywhere from 10 to 20 degrees. But most importantly, we want to see differences side to side. So if I can rotate my tibia 15 degrees one side, and I can only rotate it 3 degrees on the other side, here's how we test it. We're going to sit on a surface where our knees and hips are flexed to 90 degrees. 90-degree knee flexion is where we're going to get the most tibial internal rotation. So I'm going to squeeze a block between my knees here, which is going to prevent the femur from internally rotating as I move my shin. So I'm going to squeeze the block, and then I'm just going to move my heel outward and my toes inward, okay? And the main bone we're looking at here is this tibial plateau, okay? This bony prominence on the front of your shin here. Okay, we want to look at that relative to the kneecap. Okay, we should feel this bone moving underneath our finger as we rotate the foot out and in. So again, 10 to 20 degrees tibial internal rotation, that's what we're looking for. The second test, which is commonly overlooked, is the lateral knee to wall test, looking at the ability for the tibia to internally rotate relative to the foot. So with the foot facing straight ahead, we should be able to keep all points of contact of the foot on the ground as the knee goes toward the wall here, okay? If I move my knee laterally and the inner part of my foot comes off the ground, that means that foot is coming along for the ride, and we've lost the ability to internally rotate the tibia. So ideally, we should be at a fist distance away with the knee slightly over the midfoot. We need to keep everything square ahead, external rotation at the femur. Now, I'm passing this test, but it looks like I'm getting very light on the medial contact of my ball of the big toe here. So I think a more accurate test would be there. Okay, so this has a little bit of work to do. If you can't get a fist away here without the foot coming along for the ride and the medial part of the foot staying on the floor, then that means you need to work directly at the foot, working on the ability to create that forefoot inversion for the foot to stay on the ground. The way you'll do that is working on strengthening these lateral calf muscles, the peroneals here, which produce eversion of the calcaneus and forefoot inversion. Functionally, people who are limited in this test, when they walk, they constantly complain about not being able to feel medial foot contact as they're walking. They feel like a lot of their weight is on the outside of the foot. And you'll even see their shoe mostly worn down on the outside relative to the inside. And I'll show you an exercise how to fix that in a bit. Now, if there's a significant limitation in the open kinetic chain tibial internal rotation, then that would mean we need to improve some femoral external rotation to improve that relative tibial internal rotation. Remember, when the femur internally rotates, it generally drags the tibia along with it. But when we externally rotate, we dissociate motion from the femur and the tibia. So we uncouple the two, meaning if I improve the ability for the femur to externally rotate, then as a direct consequence, we will improve some of that tibial internal rotation, and this is going to have more carryover into functional movement. So I got some great exercises to show you. Let's get into them. Set up on an incline bench with the knee angle at 90 degrees and the knee directly in line with the hip. The idea isn't to max out hip external rotation at the start because we want space for the pelvis to rotate on that fixed femur, which will improve that closed kinetic chain external rotation. Notice at the bottom, the torso rotates across the stretching side knee. This is a relative adduction as we're stretching some of those lateral hip tissues, which will improve the space to externally rotate. Then at the top, we fully shorten those hip external rotators in extension, moving dynamically through adduction and hip flexion at the bottom, and then rotating the pelvis away through abduction and hip extension allows us to lengthen and strengthen the fibers that allow us to produce external rotation and move into it. It's important that we're constantly shifting our weight forward onto the knee so we can put pressure on the shin bone, which will actually produce some downward force into the shin and improve some of that relative tibial internal rotation. Now, like all the stretches you see on this channel, we can use some external weight. One option is holding it in the opposite arm underneath the stretching side leg, or if we want to increase the leverage, we can put that dumbbell on the back of our head, rotate the sternum toward the knee, and then rotate the pelvis away, constantly shifting our weight forward to improve external rotation at the hip. For this next exercise, set up with the inside of the foot elevated on a wedge. I'm going to drive my knee forward over the big toe, and then I'm going to press through the ball of the big toe, lifting my lateral foot, the pinky toe, off the ground, off the wedge, as I continuously drive my knee forward. We're also going to hover the heel in this position as well, so we're driving through those plantar flexors, specifically the peroneal muscles on the lateral calf. You can see as I hover the heel here, the tendons behind my lateral malleolus really pop out. That's the peroneus longus muscle as it travels down the lateral malleolus across the foot into the inside of the arch. Now, of course, we can load this externally with some weight held on the same side, continuously driving through the ball of the big toe, and over the course of this isometric, trying to move the knee a bit further forward without the knee collapsing too far to the inside. We want to keep that knee just over the big toe. After coming out of this, when you walk around, you should feel like you're able to keep way more pressure through the inside part of the foot. Now we can work on expanding that range of motion in the open kinetic chain, meaning the tibia is now moving on a fixed femur. You'll notice my opposite leg is abducted like I'm in a seated pancake, and I'm also keeping the knee out on the stretching side to further dissociate tibial internal rotation from femoral internal rotation, preventing that knee from diving inward as we move the foot inward. Now in order to find the stretch, I'm passively moving the foot inward relative to the fixed femur. We want to actually see that tibial plateau moving inward as we pull the foot, and we're not just inverting the foot, which is why I'm actively dorsiflexing the ankle to prevent any excess inversion from happening. So the first contraction, I'm driving the foot laterally, which is contracting my lateral hamstrings. We should feel the lateral hamstrings push out into our forearm. So I'm going to hold that about 10 seconds, and then I'm going to move inwards the opposite direction, contracting my inner hamstring. Again, I should feel the inner hamstring tendons pop into my forearm. And we're going to repeat this cycle on and off. So here I'm just showing myself feeling those inner and outer hamstrings. So perform this for 3 to 5 cycles, moving into more internal rotation each rep. In this next exercise, we're going to develop some usable internal rotation at the tibia through strengthening knee flexion with the toe facing inwards. Now in this variation of the hamstring bridge, I'm letting the femur move into internal rotation, which drags the tibia along with it. This is going to help us bias the medial hamstring, which many people have a very difficult time finding when they're doing knee flexion related exercises, and these are generally people who struggle to internally rotate the tibia. So we can perform this hamstring bridge variation as a static isometric, which I like to use for beginners so we can really feel that medial hamstring and ramp up the strength of the contraction over the course of 45 to 60 seconds. And as a progression, we can move dynamically up and down through the bridge, not extending the hip all the way, just thinking about moving through a small excursion of the range, anteriorly and posteriorly tilting the pelvis. As a progression to further dissociate the tibia from the femur, we can pull the knee out into a little bit of abduction and external rotation while trying to keep the toes pointing inwards as much as we can, which if you're limited in your tibial internal rotation range, it just might look like the toe is facing straight ahead. One of the main compensations we want to look out for is the pelvis completely twisting to the side when we're choosing this abducted and externally rotated bridge variation. Keep the pelvis facing completely square and the belly button pointing up toward the ceiling. Again, we should feel a strong contraction through the inner hamstring as we crush the heel down into the bench and either hold isometrically for time or dynamically for reps. And lastly, a more integrated exercise where we're moving the knee through full range of motion with this front foot elevated contralateral split squat. The combo of a front foot elevation, a slight pelvic turn toward that fixed leg with the toes facing forward, will bias full range hip and knee flexion. So we not only strengthen the quad in that bottom range, but improve some of that relative tibial internal rotation. As promised, here's the plan all laid out for you. You're going to perform this 2 days a week. This is a systematic way to improve your usable tibial internal rotation, starting with range of motion development, improving the mobility of the shin to rotate inwards, and then integrating that with exercises that strengthen the tibial internal rotators, such as the medial hamstrings, and exercises that take the knee through a full range of motion in the closed kinetic chain, where we can bias that relative tibial internal rotation, like the front foot elevated split squat. So if you train lower body twice a week, this would be excellent to perform as your warm-up, to not only mobilize the hips, but also the knees and the ankles, which will also help improve that relative tibial internal rotation. So we're going to start the session off with the flexibility and mobility work. Do about 2 to 4 sets. Depending on the time you want to devote, 4 sets, you'll maximize the range of motion here. So we're going to start with the pigeon airplane exercise to improve that hip external rotation, anywhere from 8 to 12 reps with a 3 to 5 second hold in each position. And of course, feel free to use external weight. And then moving on to the seated tibial internal rotation contract relax, contracting for 10 seconds each, making sure we're feeling those medial and lateral hamstrings driving the motion, and we're not just pushing the foot into the hand via the ankle. And last, we finish that mobility superset or triset with the peroneal yielding isometric, holding for around 40 to 60 seconds. If you could do that comfortably, then feel free to add some weight held on the side of the same side leg that is forward. You don't need a lot of weight here. Anywhere from 8 to 16 kilogram kettlebell works just fine, making sure you're hovering the heel, getting a lot of load through those lateral calf tissues. Now that we've opened up that range, we're going to integrate this new range of motion into the hamstring bridge with tibial internal rotation. I encourage you to start with the variation where the femur is moving into adduction and internal rotation, which will already pre-position the medial hamstring to do the work when we crush the heel down into the bench. And as you progress, move that knee out into more abduction and external rotation at the hip, while trying to continuously drive the toe inward to dissociate that tibia from the femur even greater. We can also start to move dynamically for anywhere from 12 to 15, even 20 reps as a progression as well. I generally like beginners starting with the isometrics because we can really concentrate that contraction into the medial hamstrings and feel that contraction ramping up over the duration of that isometric. And then finishing with some closed kinetic chain unilateral tibial internal rotation with the front foot elevated split squat. Again, elevating the foot anywhere from 6 to 12 inches so we can bias that hip and knee flexion. Loading the quads in that bottom range, keeping a slight pelvic turn toward that working side. We're going to get some really nice relative tibial internal rotation happening here once we've opened up the range. All right, guys, this is how I would go about developing tibial internal rotation from a relative motion perspective, as well as getting load into some of the tibial internal rotator muscles and moving through full range in a closed kinetic chain fashion. If you found the video helpful, give the video a like. And if you have any questions, feel free to write it in the comments. I'd be happy to answer. Stay supple.